Hello, my name is Marcus Chavez and I'm with Afara TV. Today we will be cablecasting segments of the press conferences that were held during the 22nd CROI, which is the annual conference on retroviruses and opportunistic infections, which took place in Seattle, Washington this year. This segment will be presented by David Wyles, who's with the University of California in San Diego. David talks about the Ally 2 study, which is a study conducted in treatment-naive versus treatment-experienced patients. Ally 2 looks at the effectiveness of declastevir and sofosbuvir to treat patients with HIV who are also hepatitis C co-infected.
My name is David Wyles. I'm from University of California, San Diego. I presented two studies. I'll just talk briefly about the first, which was really an analysis of viral kinetics on treatment in patients treated with the 3D HCV regimen for their HCV, and it was a comparison of viral kinetics in a smaller co-infected study to a large database of the mono-infected patient experience. And really, the moral of the story is that patients rapidly suppress HCV RNA levels, with almost all suppressed by 4 weeks. And that really is irregardless of co-infection status or other traditional baseline predictors of poor responses, and that you have very high SVR rates. Finally, that you can't use on-treatment viral kinetics really to decide a futility in terms of these new potent DNA regimens. The second study was the Ally 2 study, which was a phase 3 study that looked at sofosbuvir plus declastevir in co-infected patients. It looked at about 200 patients. There were 100 treatment-naive patients treated for 12 weeks with that regimen, about 50 that were treated, also treatment-naive, that were treated for 8 weeks, and then another 50 that were treated, treatment-experienced patients treated for 12 weeks. This study allowed in not only genotype 1 patients, but patients with any HCV genotype, although non-1 genotypes were capped at about 20%, and we did allow up to 50% cirrhotics. As far as the 12-week treatment regimens went, treatment responses were very high, 96 and 98% SVR rates. Overall, in treatment naive was 96% with 12 weeks, and actually 98% in treatment experienced patients that were treated with 12 weeks with sofosbuvir plus declastevir. And those numbers were essentially identical then when you brought in the non-genotype 1 patients. In the 7-week arm, the treatment response decreased to 76%. In those patients, again, they were treatment naive patients, but we did allow cirrhotic patients who were treated with just 8 weeks of sofosbuvir plus declastevir. The reasons for that low response rate, we really can't divine from this study based on the relatively small numbers when we try to look at other factors that may impact that. Some considerations were that we did allow cirrhotics, which traditionally had not been looked at in shorter duration treatments, but there were only 5 patients there. And then the potential impact of using a lower dose of declastevir and ritonavir-boosted PIs, where subsequent pharmacokinetic data have suggested that ritonavir-boosted darunavir does not increase declastevir levels as much as expected. But again, those are all speculative.